Body language is a non-verbal language that is very important to have good relationship with your patients and with your colleagues. But body language differs depending on which country you are. In this episode, we're gonna go over how to use your body language for nurse practitioners and nurses. Let's dive in. Hi, we're gonna get into today's topic in a minute. But before we're gonna dive into today's topic, I just wanna mention that we are giving out free access to our online workshop. This workshop is about confidence. We had this workshop and we got so many good responses, feedbacks from the audience. So I wanted to give it out to more people so that you can boost your confidence and get more career opportunity, get into your dream nurse practitioner programs, and get pay raises. How you can sign up and how you can get access to this workshop is go to a website, usa.jnpproject.com/confidence. Again, usa.jnpproject.com/confidence and sign up for our free email list. This is a 90-minute online workshop. You can watch it as many times as you want. It also comes with a handout of the slides that I used in the workshop. Again, a lot of people loved it. It really helps to boost your confidence. So I want you to have the opportunity. So please sign up. All right, let's get into today's episode. So today's topic is about how to use body language. This is part 1 of 2 episodes. There are a lot of body language that we have to master as a nurse practitioner or a nurse. And I divided it into 2. So this is a part 1. So please look forward to the second part. But so giving a good first impression to your patient is very important, whether you are a nurse or nurse practitioner. But especially if you are a nurse practitioner, this is very critical because as a nurse practitioner, you are evaluated based on different things, but a lot of times you evaluate it based on productivity and then the size of patient panel. So productivity usually means how many patients or how many visits you saw for that day or for a certain period of time. Did you see like 3 patients for the 8 hours or did you see like 18 patients for 8 hours? Because as you see more patients or have visits, that means that you can bring more income to the facility and that helps to run the business for health center, clinics, and hospitals. So that's very important from the business perspective from your employer. So you are evaluated based on productivity. How many patients did you see? How many visits did you see for that day? Also, the size of patient panel is also very important, meaning that how many patients are under your care. Sometimes it depends on where you work. Sometimes nurse practitioner may not have their own panel, but sometimes for my main job, I have my own patient panel. And let's say if one nurse practitioner have only 100 patient panel versus this nurse practitioner has 1,000, 10 times more, 1,000 patients on her panel, then she might get more bonus because that means that she has more patients that she's taking care of. So to build the size of the patient panel and also to be able to see more patients, you have to be chosen by your patients because patients can choose who they want to see. They can choose to see physicians. They can choose to see another nurse practitioner or another provider. So you have to be chosen as their healthcare provider. So how you do that, you have to build a good trust relationship with your patient. So the beginning of that is giving a good first impression. And body language is a key to have a good first impression. But the tricky part about the body language is we do it unconsciously. I do it unconsciously too. Sometimes I'm like hunching, maybe I'm tired, and then I just don't realize how I'm acting. But it affects how others see you. So it's very important for us to master it so we can give a good impression to them, and then we can convey the message that we really want to convey. And the problem is the meaning of body language can be different depending on which country or which culture you're in. And especially if you are coming from, if you are trained or coming from other country like myself, I was born and raised in Japan. Same body language can have a different meaning, depends on where you are. So it's very important to understand how body language is interpreted in the United States, if you want to be a nurse or nurse practitioner in the United States. So this is a part 1. We're going to go over 3 body language today. So first one is the handshake. So handshake is a very, very important tool in America. This is very important to give a good first impression. In some other country like Japan, usually handshake is not a thing. We usually bow and stuff like that. So it's different. But when you're in America, you have to adjust. You can't be like, this is not how we do in where I'm from. You can keep that when you're in that country. But if you want to be perceived as a good nurse practitioner or nurse, you have to adjust to a new culture. So handshake. And, this, you do handshake when you introduce yourself to your patients, but also it can be to supporting staff or other, colleagues. I usually intentionally introduce my, nurse practitioner students to everybody in the clinic because I believe that is very important. We work as a team. And, oftentimes if somebody's not introducing themselves and then we wonder like, oh, who is that? But, I think it's very important to introduce yourself and have a good connection so that you can work as a team better. And handshake is very important part of the self-introduction. So when you are giving handshake, in America at least, when you are giving handshake, that means that you're taking time, well, first of all, you're taking time to connect with the person. So if you just say, oh, hi, I'm Miki Miura. I'm a nurse practitioner. Or usually, when I meet a new patient, I usually say, hi, I'm Miki Miura. Or, you can call their name too. Hi, Anne, or, I can't think of the name, but, let's say Anne. Hi, Anne, I'm Miki Miura. Or you can say, hi, Miss Smith. I'm Miki Miura. I'm a nurse practitioner. Nice to meet you. I definitely say my name and, my profession, but, usually I give handshake. So the difference is if you just say it, hi, I'm Miki Miura. I'm a family nurse practitioner. Nice to meet you. Versus if I say the same thing with a handshake, hi, I'm Miki Miura. I'm a family nurse practitioner. Nice to meet you. Usually that gives a little bit of oomph. That means that you are actually taking time. You want to connect with the patient. So that gives impression that you are more approachable. You are open to the patient and you want to get to know them. So important to pay attention to what you say, but also body language is very important. And again, the handshake means that you recognize that they're there, and then also you want to get to know the person. So you feel like when you're just saying, like, kind of distanced, hi, I'm Miki Miura, I'm a nurse practitioner, nice to meet you. Versus if I say it the same thing with the handshake, that person, this action, the handshake, can inspire trust and intimacy so that patients or whoever's receiving a handshake or engaging in a handshake feel like, we are a little bit closer, So this is not only applied to when you're introducing yourself to patients, but also when you're introducing to, If you're a nurse practitioner student, you're introducing yourself to staffs at the clinic that you're having clinical training at, or maybe senior nurse practitioner, so that maybe they are more willing to help you because they feel like they know you a little bit better than no handshake. And you will more likely to remember that person who did the handshake over a person who didn't do that handshake, say the exactly the same thing, but because you felt like you're a little bit closer to the person, you might remember the person with the handshake better. So you give a little bit stronger and better first impression. So handshake. Here's the important part. Just doing the handshake is not enough. You need to do the good handshake. So what is a good handshake? So again, body language is different depending on which culture or which country you are in. But in America, handshake has to be like firm, meaning it's not like, you don't want to do like super too strong, but it's called, what is that called? The bone crusher. It was interesting when I was like researching for this episode, that word popped up and I was like, well, that sounds very painful and aggressive. If it's too firm in America, I guess it's called bone crusher. You don't want to do that. That seems too aggressive. Maybe you feel the other person get an impression that, oh, maybe Miki is angry. You don't want to give that impression. But it has to be firm. It has to be like good handshake. Because if it's too soft, like if you're like barely touching your hand, you're like, kind of thing, then it's all, I guess in America, it's called limp fish. That's funny. But it gives a signal that you are either nervous, uncertain, you don't want to connect with the person, you don't want to touch. Maybe you're thinking that, the other person's hand is dirty. I don't want to touch it, So even if you do handshake, if you don't do a good handshake, that can actually give a worse impression. So if you decide to do handshake, you need to do good handshake. Maybe if you do that bad handshake, maybe it's better not to do handshake at all. But so practice good handshake. It has to be firm, not bone crusher, but also not limp fish. It has to be like firm. And especially in the healthcare, we went through the pandemic, but especially in the healthcare, patients know that you see different patients, you do different procedures. Some patients might have a germaphobe tendency, and they might feel like, I don't know if that person's hand is clean. And it is also a good bedside manner to wash your hand or use hand sanitizer. You can use hand sanitizer right in front of them, so you can show that my hand is clean before you handshake. So sanitize or wash your hand as soon as you enter the room. Or there is hand sanitizer outside of exam rooms of what I use. So I usually just use that, and then as I enter, I show them that I'm sanitizing my hand before I, shake my hands with them. And some people may not want to do it. Maybe they're, afraid of the germs, or maybe they just don't prefer to, I've met even some Americans prefer not to do the handshake, or that person is from other culture like Japan and they're not used to do the handshake. Maybe they don't want to do that. That's fine. But at least by gesturing that you are willing to do so, at least that can convey them that, hey, I really want to get to know you. So that is still a good gesture, even if they are like, they're avoiding. That's fine. Don't take it personally, but you are all still giving a good impression that, I'm here for you. I want to get to know you. So try to do that. And then when you do handshake, make sure you make eye contact with that person. That is a manner in the United States. And then also, if you don't, you look like you're not opening your heart to them. So let's say, let's compare. So if you're going to do handshake, the good example would be, hi, I'm Miki Miura. I'm a family nurse practitioner. Nice to meet you. Or you do firm handshake, but you're not looking. Hi, I'm Miki Miura. Nice to meet you. what kind of impression do you get from two examples? The second one, without the eye contact, you might not feel like you're connecting to me as much as the first example. So good handshake involved with firm handshake, but also good eye contact. Okay, so second, since I mentioned about eye contact, I'm going to dive into the topic a little bit deeper because this is very, very important in America. So, some cultures like, Japanese culture actually don't really prefer intense eye contact. It depends, again, how body gesture mean is different depending on cultures and, countries. Like in Japan, if you have intense eye contact, sometimes that can be seen like you're aggressive or you are very intense. But in America, for the most part, having a good eye contact is a very important and a good thing. So usually in America, if you have a good eye contact, that means that you're telling the other person that you are engaging, you are listening to them, you want to get to know them, you're opening your heart to them. So it's very important to make eye contact when you're talking to them. And even if you are, when you go into the room and, I mentioned this in the episode when I talked about, how to speed up your documentation and, sometimes you have to type some keywords and take notes. So sometimes you have to look at that. It's hard to talk to them and then literally not looking at the screen for even a second. It's hard. So you sometimes have to look at it. But make sure you look at it, but make sure you make eye contact a lot. You can take a look for a minute. Maybe you have to look at, if the patient asks when was my last pap smear? You have to look at it. Of course, you have to move your eye to the computer, but you don't want to do that the whole time because the patient might feel like, oh, Miki is not really interested in my stories or what I want to say, or she doesn't really care about me. So you want to make sure that you make good eye contact. So I usually try to angle myself. So let's say I have a computer here, it's stabilized to the walls, I can't really move, and patient is sitting there. I usually I try not to do this, but I usually try to face my patient, but then use the computer here and there. So, okay, let me check real quick. So it looks like your pap smear, the last one was back in 2022. So I try to do that instead of okay, so your last pap smear was 2022 or 2020. You receive, especially, Americans feel a different impression because eye contact is extremely important in American culture. So try to make eye contact as much as possible to show that you are listening, you're interested in what they are saying, and then you are open to, you're opening your heart to them. And eye contact also, in America, eye contact also means that you are confident in yourself and then also you are trustworthy. Again, if you haven't watched the confidence workshop, please do so because I go over this too. But confidence is very important in America. Not just that, you feel good about yourself, but also, patient trusts you more. Because, we are, nurse practitioners are dealing with very important health matters for patients. It could be life or death, but it might not be life or death, but, definitely it's important for patients. So patients want to have trustworthy providers, and you need to show that, hey, I'm confident in what I do. So very important to have good eye contact to tell them that, hey, you can trust me. You can trust me. So it's very important to have good eye contact, to have good trust relationship with your patients. Another important thing to note in this DNA age is that, we do telehealth I still do telehealth. We did a lot of telehealth when the pandemic was bad. Well, I still do telehealth when we review some results of the blood test or x-ray imaging and stuff like that. Patients love it because they don't have to come in. It's easier for them, especially if they just give birth, if they have children, they don't have any babysitter, so many nurse practitioners use telemedicine or telehealth. So it's like a Zoom call that you see patients on the other side of the screen, or on the screen. But here's the tricky part. A lot of times when you're looking at a computer, the camera is on top of the computer, but the patient's face is on the screen, and unconsciously you're trying to look at patients. That, okay, I have to have a good eye contact. So you try to look at patients' eyes on the screen, but the camera is actually above. So if you're actually looking at patients' eyes on the screen, it kind of looks like you are looking down, not looking at patients' eyes. So when you do telehealth, I always tell myself, look at the camera. That's how patients know that I'm looking at them. So, it's a little tricky because, it's a technology. It's a little tricky. You have to look at the camera for patients to feel like you are looking at them. So let's be aware of this so that your effort actually means something. Last thing I'm going to mention in this episode, remember we had part 2, but in this episode is a posture. So there is open and closed posture. So open posture meaning that usually means you are friendly, that you are approachable, and then you're open and you're willing to get to know the other person. You're willing to listen to the other person. So this open posture, it's very positive. This usually involves with keeping the trunk of your body open, your chest open, your body open, and then exposed, meaning that your face forward, not looking down, but face forward. And then also arms apart, not like this, arms apart. And then also chest out. Open posture also convey message that you are confident in yourself and you're trustworthy. Again, that's very, very important to have a good trust relationship with your patient. So that's the open posture. The opposite is closed posture. So closed posture usually involves with arms and legs closed and then hunching down, This usually means, people get impression that you might be uncomfortable, you are not open, you're closed, you don't want to hear what other person's saying, and then you're hostile, you're unkind, unfriendly, you don't have any confidence, you're kind of like curling up, and then you just want to be in a little cubicle. So usually that's not a good impression. So you try to do the open posture to give a good impression. And if you haven't watched this yet, watch Dr. Amy Cuddy's TED Talk about body language. You can just Google Dr. Amy Cuddy TED Talk, and then that should pop up the video. But I also put a link below in the comment section. But the video was very, very helpful when I was newly graduated nurse practitioner, and I was, struggling with building confidence, and it really helped. It was like eye-opener, and it was inspirational. So what she's saying is that when we do, even if we don't feel confident, if you do a confident posture, interestingly, it gives a signal to the brain and you actually start to feel confident. So it's very important not only to give good impression to others that you're confident, but also you can kind of trick your mind too. That I am confident. Then you start to feel like, I actually feel confident. So watch that episode or the talk. It's so wonderful, so wonderful. So I went through 3 things today. There's part 2, but today we went through the handshake, good handshake, eye contact, and then a posture. And remember that we often use our body language unconsciously. I do that all the time, and I sometimes, especially when I'm in a hurry or when I'm stressed out, I have to remind myself that I have to correct my body language, because even if we have a good intention, we might be sending wrong message to others, including patients and your colleagues. You want to make sure that you are actually sending a message that you actually want to. Like, I'm listening to you. You can trust me. I care about you. Those messages should be conveyed, but it's not just through the words, but also with body language. Okay, so Part 2 is coming up in a few weeks or so. So make sure to subscribe so you're going to get a notification. But I'm hoping that you like this episode. Please write any comments, questions, requests for future episodes. Really appreciate it. And don't forget to give me a thumbs up if you like this episode. All right. Have a great day. Aloha.